Berberine is an ancient natural compound, known for centuries, and praised for many potential benefits. Recently, it has become very popular, a trending topic, and people everywhere are talking about it. But as we know, most discussions focus only on the positives of herbs and natural substances, while often hiding the risks, side effects, and dangers. Today's video is all about berberine. What exactly is berberine? And does it truly have proven benefits for people? Who are the individuals who should never use this substance? What are the confirmed medical uses, supported by strong scientific studies? Which natural sources actually contain berberine? What is the safest and most effective way to take it, as an herb or as a capsule? What are the most important drug interactions with the medications we may already be taking every day? And finally, how can you select a high-quality product that really contains berberine? Stay with me. Let's uncover the facts together. Hello, I'm Hussein Lotfi, and you're watching the channel Octopus Pharmacist. Welcome to a new episode of Octopus Pharmacist Herbal. Welcome. As always, let's start with today's main titles. If you are searching for a specific point, you can move to the minute that begins with its title. But if you want to know everything about berberine, stay with me carefully, from the first second until the very end. First, let's take a quick overview. What is berberine? Berberine is not an herb itself. It is a natural compound found inside some herbs. It belongs to a group called alkaloids. We usually extract it from the roots, stems, or bark of several well-known plants, such as golden seal and Oregon grape. However, the most famous and richest source is a plant called zeresk, or in science, Berberis vulgaris. Second, this compound is very old. For centuries, traditional medicine has used it in many different ways. It is often said that berberine reduces inflammation, fights microbes, lowers cholesterol, helps blood sugar, decreases blood pressure, and even cures cancer. But let's pause here. Just like many other herbs you may read about, these are claims. And a medical claim means one thing. It may be true or it may not be true. That's why you should never use any herb unless you are sure about its correct medical use. And this certainty does not come by chance. It comes only after strong scientific research to confirm how effective the compound is, what concentration really works, and how we can measure its effect. And this is exactly what we're going to explore in today's episode. The second topic with us today, and as usual, I like to begin with the most important part. Who should never use berberine? Please keep this in mind carefully. Berberine is strictly banned for 6 groups of people. First, pregnant women. Berberine can cross the placenta to reach the fetus, and this may cause birth defects. In addition, it can increase contractions of the womb, which may lead to miscarriage. Second, nursing mothers. Why? Because berberine passes into breast milk and may reach the baby. It can affect the infant's nervous system, which makes it unsafe during breastfeeding. Third, children. Studies show that berberine should not be used for young children, especially under 6 years old. Why? Because it increases a substance called bilirubin, which can build up in the body and reach the brain, a condition that is very dangerous for children. And as you will see in a moment, all the proven medical uses of berberine are mainly for adults only, not for children, and not for teenagers under 18 years. So always keep berberine completely away from them. Fourth, people with liver or kidney disease. Why? Because when the liver or kidneys are weak, the body cannot break down berberine properly, and it cannot remove it efficiently. This leads to accumulation in the blood, which may cause serious problems, such as very low blood sugar or dangerously low blood pressure. Fifth, people with low blood pressure. Berberine naturally lowers blood pressure as one of its side effects. So if you already have hypotension, berberine may drop your pressure even more, and this can be very risky. Finally, the elderly, over 60 years old. Why? Because older people usually have multiple health conditions and take many medicines at the same time, what we call polypharmacy. Mixing berberine with these medications can amplify their effects. This may lead to too much lowering of blood sugar or a sharp drop in blood pressure. And in older people, this increases the risk of falls. And when an elderly person falls, even a small fracture can be very dangerous. So, these 6 groups must completely avoid berberine for their safety. The third topic with us today is about the many claims we read and hear regarding berberine. But today, I want to focus only on what has been proven by medical studies, the documented uses, and the real health benefits. According to several trusted sources, like the World Health Organization, WHO, the European Medicines Agency, EMA, and other international references, berberine has 3 main medical uses that are strongly supported by evidence. Let's go through them one by one. First, lowering blood sugar. This is the most important and best documented effect. Now, some people might immediately think, great, I'll stop my diabetes medication, I'll stop insulin, and I'll just use berberine. But this thinking is completely wrong. Why? Because berberine does not replace insulin, and it does not solve the core problem of diabetes type 1. People with type 1 diabetes must use insulin. That is their main treatment, and berberine is not a substitute. Now, for type 2 diabetes, berberine can lower blood sugar. But there's a problem. Unlike prescription drugs, herbs and natural compounds do not give us exact numbers. We cannot always predict how much berberine will lower blood sugar or how strong the effect will be. It helps, yes, but it is not precise enough to replace standard medical care. So, when do we use berberine? The best example is in people who are pre-diabetic. Let me explain. When we check blood sugar with a test called HbA1c, if the number is between 5.7% and 6.4%, we call this prediabetes. It means the person is not fully normal, but also not a diabetic patient yet. Before 2023, the advice for prediabetes was always change your lifestyle, diet and exercise only. Come back after 3 months for another test. If the HbA1c improved, we told the person to continue with lifestyle changes. No medicine was needed. But with the newer updates, if the person is overweight, especially with fat around the abdomen, a condition linked to insulin resistance, we can now add berberine as support. Why? Because in these people, the body produces a lot of insulin, but it doesn't work properly since fat blocks the receptors. Here, berberine can really help, but only together with diet and exercise. The recommended dose is 500 milligrams after meals, 2 to 3 times daily. When combined with lifestyle changes within 3 to 4 months, the HbA1c can drop by about 1%. That's a significant improvement, and it may even return a person to a normal range. But again, remember, berberine works best with diet and exercise. Alone, the effect will be much weaker. Second, lowering cholesterol. The second proven use is that berberine acts as an anti-hyperlipidemic, meaning it helps reduce cholesterol. Now, the research on blood sugar control with berberine is very strong. The research on cholesterol is moderate, but still shows good results. With a dose of 500 milligrams twice daily for 3 months, berberine can reduce the bad cholesterol, LDL, by about 15% to 25%. This is impressive, but again, we need to be careful. You cannot stop your prescribed cholesterol medications and replace them with berberine. Why? Because many patients, especially those with diabetes, heart disease, or kidney problems, absolutely need to prescribe cholesterol drugs. So, when do we use berberine here? In a patient who is generally healthy, no chronic diseases. All tests are normal, but cholesterol is slightly high. For example, a young or middle-aged adult with only mild cholesterol elevation. In such cases, we first recommend lifestyle changes, diet, exercise, and weight control. And then, adding berberine can be very helpful, and within 3 months, cholesterol can return to normal. Third, treating SIBO and intestinal infections. The third confirmed use is for a condition called SIBO, small intestinal bacterial overgrowth. We talked about SIBO before, but let me remind you, it happens when bacteria multiply abnormally in the small intestine, leading to digestive problems. Berberine has a very strong antibacterial effect. That's why it can be used in certain cases of bacterial diarrhea. For example, in acute bacterial diarrhea, berberine can be taken at a dose of 500 milligrams 3 times daily for 3 to 7 days. This works like a natural intestinal cleanser, safe and effective. In the case of SIBO, the dose is usually 500 milligrams twice daily for 1 month. This reduces harmful bacteria in the wrong part of the intestine and greatly improves symptoms like bloating, abdominal pain, constipation, or diarrhea. Doctors usually prescribe antibiotics as a first step for SIBO, but berberine can be considered a natural option, and research shows its safety profile is high. Other possible uses. Now, outside of these 3 proven uses, you will hear many other claims about berberine. Some say it helps in polycystic ovary syndrome, POS. Some say it improves non-alcoholic fatty liver disease, NAFLD. Others claim it can even treat cancer. But all of these are still medical claims, not proven facts. Until now, there is no strong scientific evidence that berberine cures these conditions. What we have are personal experiences or very early research results. So for now, let's stay focused on the documented, proven uses: lowering blood sugar, lowering cholesterol, and treating certain intestinal infections like SIBO. These are the real, evidence-based benefits of berberine. The fourth topic with us today is very important. How long can berberine be used safely? And what are the best ways and times to take it? Let's go step by step. First, duration of safe use. When berberine was studied, it was tested for a period of at least 6 months. So, we can say that it is generally safe to use for up to 6 months. However, some sources and studies have reported its use for as long as 2 years, and they found no major safety problems. But there's a very important point here. If berberine is taken for longer than 6 months, it becomes necessary to monitor liver and kidney functions. Why? Because some studies found that these organs can be affected by long-term use. So, the safe advice is this: use berberine for 6 months, then stop for another 6 months. If you need it again, you can restart for 6 months more. This way, you gain the benefits and avoid the possible risks. Second, best way to take berberine: always take berberine after meals. Why? Because dividing the daily dose into 2 or 3 smaller doses reduces digestive problems, such as cramps or diarrhea. Third, capsules or raw herbs. The answer is clear. Capsules are better, not because of selling products, but because capsules guarantee purity, a measured dose, and a known percentage of the active substance. Raw herbs that you grind yourself may contain bacteria, unknown impurities, or inconsistent amounts of berberine. Also, taking berberine without capsules can irritate the digestive system and even cause severe diarrhea. So capsules remain the safest and most effective choice. The fifth point with us today is very important. What are the drug interactions of berberine? Please keep this in mind carefully. As we explained before, berberine lowers blood sugar, blood pressure, and cholesterol. And because of that, using it without medical supervision can be risky. So always take it under the guidance of a doctor who can decide when and how it should be used. Now, let's look at the 3 most important interactions. First, interaction with statins and macrolides. Statins are cholesterol-lowering medications. Macrolides are a group of antibiotics with many names under them. When berberine is taken together with these drugs, it prevents the liver from breaking them down properly. This causes their levels in the blood to rise much higher than normal. For statins, if the concentration in the blood becomes too high, the doctor may see unusual results in tests, and the patient can develop dangerous side effects. That is why berberine should never be combined with statins. The same applies to macrolide antibiotics. If they are taken with berberine, their breakdown slows down, their levels rise in the blood, and this can lead to serious side effects. Second, interaction with blood-thinning drugs. This includes medications such as anticoagulants and antiplatelet drugs. The scientific evidence here is not as strong, but the risk still exists. Berberine can increase blood flow, and when combined with these medicines, the effect may become too strong. This could increase the risk of bleeding. So, people using blood thinners should avoid berberine to stay safe. Third, interaction with diabetes medicines. And here I must stress this again. If a diabetic patient is already taking medication to lower blood sugar, adding berberine can drop sugar levels too much. This can cause dangerous hypoglycemia. So, in all three cases, statins, macrolides, blood thinners, and diabetic medications, berberine must be avoided unless your doctor gives you a safe and clear plan. The sixth and final point with us today is this. Imagine I'm a healthy, normal person. I don't have any medical problems, but I want to use berberine to help improve my cholesterol or maybe to balance my blood sugar. What should I keep in mind when choosing a good product? There are 5 important points you need to consider. First, the concentration of the active ingredient. Always choose berberine with a purity between 95% and 98%. If the company doesn't clearly write the concentration on the label, that's a warning sign. It usually means there's a problem or the active ingredient is not reliable. Second, the daily dose and the number of capsules. Most people need between 1,000 to 1,500 milligrams daily. Now, how do you know how many capsules give you this amount? Check the label carefully. For example, if one capsule contains 500 milligrams, it becomes simple. You only need 2 or 3 capsules a day. But sometimes the label says, serving size equals 2 capsules. If that's the case, it means the total written amount is divided between 2 capsules, not 1. So, to reach the full daily dose, you might end up taking 6 capsules a day, 2 at breakfast, 2 at lunch, and 2 at dinner. So always check how many milligrams are in each capsule, not just the serving size. Third, absorption enhancers. Berberine on its own is not absorbed very well by the body. That's why some companies improve it. For example, they may add black pepper extract or produce it in a liposomal form, or use a special form called hydroberberine. Any of these 3 options can make the absorption much stronger and the product more effective. Fourth, the form of the supplement. On the market, you'll see berberine sold as capsules, tablets, liquid, or powder. Always choose capsules or tablets. Why? Because berberine has a very bitter taste. If you try to use it as a powder or liquid, it will be very difficult to take regularly. Fifth and final point, quality certification. Always buy from a company that has proper GMP certification, good manufacturing practice. This guarantees that the active substance inside is pure and that the product is made under high-quality standards. And that brings us to the end of our talk about berberine. I hope the information today was clear, simple, and useful. If you enjoyed this content, and if you'd like to support the channel, please don't forget to like the video and subscribe. Hussein Lotfi,